Hi, nice to see everybody today. I know this part of the room. Just can you give me an idea of who are the other people in the room? Okay, great. Okay. Okay, cool. Okay, great. Anybody else? What's your background? Okay, that's what I thought. I was probably talking to mostly industry people, but that's okay. So for the patient family in the room, why are patient-reported outcomes important? And answering the questions of what's important to you. And I think what's important to the patient is in patient advocacy, right? You know this. It's such an important question that I think is becoming louder and louder over the last 10 years or so. I can just tell you quickly who I am. So, my name is Stephanie Austin. My background is genetic counseling, and I'm currently an employee at Amicus Therapeutics, so also industry. But I'm here today on behalf of the Scientific Advisory Board for the AGSD. Before I was at Amicus, I was at Duke for 13 and a half years and worked in the metabolic space with glycogen storage diseases. And I've been on the SAB, I don't know, 10 plus years now. So I've been to a lot of the AGSD meetings, and this is always a really nice space to talk with families and other providers, I think. So, first, thank you for having me. And second, please, this is informal. I'm going to give a background introduction so that Dr. Dirks then can share more specifically about the disease specific health quality of life. So again, I am an employee of Amicus, but nothing I'm sharing today is on behalf of Amicus, and I don't really have any conflicts on this information. So I'm going to go through what are patient-reported outcomes. When you're selecting patient-reported outcomes, what are physicians and pharmaceutical companies and healthcare providers thinking about? What are some of the measures and techniques that are used? How are PROs used in monitoring and treatment development? So some examples from some current clinical trials, and then just a summary at the end. So what are patient-reported outcomes? Or a patient-reported outcome is any report of a patient's health or condition directly from the patient, right, without interpretation of the patient's response by a clinician or anyone else. And these can be several outcome assessments, whether they're the burden of the disease, survival. They can be used in clinical trials to better inform the benefit of the trial or the medication. So the measures themselves then are the instruments used to measure the patient-reported outcome. And these are often self-reported questionnaires. I will give another example when the questionnaires or the measures are given to the patient by someone else. So although investigators may try to address these patient-relevant outcomes, they're not patient-reported measures, but rather clinician-reported or observer-reported outcomes. So some of the types of assessment, like I said, either a self-report, so that's a direct report from the patient or the caregiver about his or her feelings, function, well-being, symptoms, life satisfaction, but sometimes reported by a proxy too, right? So if you have a child in a clinical trial or you're asking about a child, often the parent's interpretation is as important as the child's information that they provide. And then there's also these performance tests of function. So a person could be asked to complete a task or activity by a trained examiner. And I'll share some examples of this health measures website. We know that there are really important core components of health-related quality of life and certain factors that can increase or decrease your health-related quality of life. So when we're looking at patient-reported outcomes, it's another way to measure this health-related quality of life. And this was a quote from the paper where I pulled this diagram, but it says, We need to make it as simple as possible for patients to convey crucial information to their physician and for the physician to act on that information. I think especially as we are having more treatments available, multiple treatments for one condition, figuring out which treatment is best for the patient, and monitoring over time, you're asking these questions. You're using monitoring and measures. So you are looking at lab tests and other procedural tests, but you're also asking the person how they're feeling. And if that changes over time, that's a point where you may consider a different treatment or a different option for that person. So you can see here all the different things that contribute to health-related quality of life. Your family life, what your work life looks like, how you're feeling, your energy. Are you able to participate in different social activities? Do you have interests in sports or hobbies? Emotional and psychological well-being. So even with the previous patient that Dr. Dirks mentioned, the idea of social participation in hobbies or other sports, that would be potentially an interesting health-related quality of life piece to measure over time for patients with muscle conditions. So why PROs? Why are we talking about these? Why are they important? It's a really great way, an important way to hear the patient's perspective, the person who has the condition and being treated. Are they receiving any benefit from the treatment or any harm? It can directly measure treatment benefit and harm beyond survival. So as you know, in a lot of the more significant conditions, one that I'm more familiar with, Pompe disease, in the beginning, the very first clinical trials were looking at whether the children died or survived, because before treatment, the children died before age 2. So that was the end point for a lot of those clinical trials. But now that we've progressed past those initial treatments, we're looking to see, is this treatment better? We're going into second generation treatments for some conditions. And is this treatment contributing to, number one, better health for the patient, but also better quality of life? Is it changing something that's important to the patient? So first we have to identify what is important, and then we have to look at that over time. So in addition, self-reported outcomes often poorly correlate with other performance-related outcomes and clinician-reported outcomes or biomarkers. So what this is saying is that when we're doing the self-reported outcomes, how a person feels over time doesn't always match if their biomarkers are improving or how they're doing socially. So you may see an improvement in social activity or fatigue, but you don't see the same improvement in the biomarkers or their other health testing. So it's really important to look at both of these and to think about how they contribute to your clinical visits with your healthcare provider. Are you being asked these questions? And then also, especially important for clinical trials, where we're looking at endpoints and things to tell us whether or not this treatment is making a difference for the group of patients. So this is another piece that Dr. Dirks will go into. But when you're putting together a PRO, and you want a really high quality one, right? It's a very intense, complicated process. So first you figure out what the topic is. You meet with groups of people who have the condition that you're interested in. You find out what's important to them. Once you have that, then researchers can take that information and write questions that potentially will answer some of these pieces about how people do over time. Then the PRO is reviewed to see if it's actually asking the questions and getting the answers that may be helpful. So you go back to the patients again and say, okay, this is what we came up with. Is this covering the things that you think are important on a day-to-day basis? And then finally, you have to test it. So you have to figure out, is it reliable? Will you get similar answers over time if you administer the questionnaire at different times? So is this something that we can trust to give us good information? Is it answering the questions that we're interested in? So how can PROs benefit patients or benefit you? Well, in this example, they talk about patients receiving chemotherapy and being asked to fill out these PROs at their clinic visits. Well, the nurses who take care of these patients regularly would get an alert if something on the PRO suggested they needed extra social work support, maybe an evaluation for depression or anxiety, so that you could intervene in a way that was helpful to that person prior to an important event or something that was more concerning. And also, when you're answering these, sometimes I think what we can recognize, and this is anyone in the room, when you feel less alone, you feel like the things that you're experiencing could be similar to other people, then you recognize that you're not the only one. And maybe that fatigue that you have is something that a lot of people who have your same condition are also experiencing. If you're a caregiver to a child who has a rare disease, you recognize through the questions that this is a stressful thing, and that other people may be feeling the same way you do. So, how do researchers or physicians determine what measures to use? Well, one of the important things is looking at change over time. So, you can use a measure to say, are you at risk for depression? And we do that now. Are you at risk for anxiety? We do that now. But we also might want to see, as Dr. Dirks had pointed out for GSD0, a patient on a treatment, you administer the measure at the beginning before the patient has started the treatment, and then maybe 6 months in, maybe a year in. So you look to see over time if there's any improvement or decline, right? Both of those pieces are important if we're looking for suggesting a different treatment in a clinical setting, adding in some adjunct treatments, or looking at the benefit of a treatment going to the FDA for approval. There are some disease-specific ones, and I know that this is something that Dr. Dirks will talk about more for the hepatic GSDs, but really the only one I'm familiar with for GSDs right now is the RPACT, which is for Pompe disease. And it's actually also a measure that came out of the Netherlands, and it's based on using this certain kind of analysis and then looking at the effects of Pompe disease on a person's ability to carry out certain life activities and also how it affects their social participation. So again, you could do this over time and look for changes. Okay, so how can you help either the healthcare providers or the patient? As we've talked, PROs can be really important ways to share experiences, improve care, and contribute to the development of new treatments. So here's a few ways that you can think about how you can contribute. One is answer each question as accurately as possible. I know sometimes you get handed these and you just kind of want to quickly go through them, but realize they are being used to make really important either decisions on treatment or decisions about your monitoring and changing treatment over time. Submit responses consistently. So you might be asked to fill something out at the beginning of a visit and then in 6 months. So try to stay on the track that's requested. If you're being requested to fill them out at home, you get sent home, try to send them back in a timely manner. So I think these are all ways that you can kind of take control of participating in your own healthcare and documenting these important changes over time that aren't always captured by the medical tests that are ongoing. So what are some examples of how this is being used across GSDs right now? So first of all, what does the PRO look like? It could be filled out on paper or electronically during a doctor's visit or a study visit or potentially at home. It asks about your health usually over a recent period of time. So it might say in the last 7 days. So make sure as you're reviewing these that you're following the directions very specifically, because you might say, oh, well, 4 weeks ago, but that's not the question. The question is what happened in, X amount of time. And then again, they're usually completed on a regular schedule to look for these changes over time. So there are some measures, and these are specific to a group of measures in the US created by one of the NIH groups. So they're free for all healthcare providers to use, and it's called PROMIS, PROMIS, and I'll share that website. But if you're thinking about physical health, they have very specific measures that have been validated across many different groups for pain, GI symptoms, sleep, fatigue. Often they look at mental health, so depression, anxiety, stress, caregiver concerns. Or social health. Are you able to participate in the activities that you're interested in? Are you able to have the relationships that you want, or are you limited by your condition? And what is your satisfaction with that participation in your everyday life? So here's an example here, actually, of one of the gene therapy trials for GSD1A. And this is looking at patient global impression of change. So you can see here, since beginning of treatment at this facility, so it's telling you the time that you should be thinking about, how would you describe the change, if any, in your activity limitations, your symptoms, emotions, overall quality of life? And then you choose one. So you can see no change, about the same, a little better, somewhat better. And you can read kind of the descriptions there to see what best measures your impression. So for this study, this was a secondary outcome. So usually in clinical trials where we're looking at the approval of medications, we have the primary outcome, which is usually something most of the time a biomarker or a medical test. So it could be lack of hypoglycemia or improvement in liver volume or reduction of left ventricular mass. So something that we can measure qualitatively or quantitatively. We can measure the number. But here they're using this measure as a secondary. So once you've fulfilled the primary, you think about kind of what are the secondary outcomes, and is there a change from baseline prior to starting the treatment to week 48, so once you finish the study. I don't think there's anybody with Pompe, but this is another example of Propel, which is actually a study from Amicus looking at, that was part of our approval for the new enzyme replacement, enzyme chaperone for Pompe disease. And you can see here again, as a secondary outcome, the primary outcome endpoint was 6-minute walk distance. So again, something numeric, something you can measure quantitatively. But some of the secondary changes were these PROMIS measures, physical functioning, fatigue, the RPACT scale that I mentioned before, the specific Pompe disease scale, and then another quality of life here. This is the PROMIS website that I've mentioned. Mostly if there's any healthcare providers that are somewhat interested in this, you can go through and you can search by measure or condition, and it gives you the report and then also how to score it. Some of them are computerized, so you have access to these healthcare providers for free. I think industry might have to pay for it, but. So then again, here are some examples of the PROMIS scales that were used, or the different health measures that were used in the Propel study. So physical functioning, fatigue. These are some of the RPACT questions, so specific to things that are important to someone with Pompe disease or where you might see a change. And then some health-related quality of life here. So, in summary, these are important measures to ensure the best healthcare decisions for patients, and that the most meaningful outcomes, the things that are important to you as a patient, are being measured, and then decisions are being made based on those questions. So your answers are important and often will inform researchers about difficult aspects of your health to measure. And healthcare providers and members of the pharmaceutical companies really need to hear from you. And this is the way that you really get your voice out there and what's important to you during these clinical trials and also during your clinical visits themselves. So there's some references here. Happy to share those if anybody has any questions. Any comments or questions, thoughts? If you're a patient, have you ever filled out a health-related quality of life or a patient-reported outcome for any clinical visit or research? No? Okay. Any thoughts about this? Do you think it would be helpful if you had a way to kind of look at over time changes? Do you feel like you're able to communicate that? Can you look back a year and say, well, this was harder a year ago? Or do you think it would be nice to have some sort of data to say, okay, I filled this out. Let me look at what I filled out now at a year and see if there's any difference? I don't know. My memory is not very good, but I also have two little kids, so I know Richie does too. So, but maybe his memory is better than mine. No. Sure. For kids, yeah, 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 yeah. Yeah. So, sure. Yeah. And I don't know that I'm honestly, I'm not an expert in PROs. But, as a genetic counselor, kind of with that idea of thinking about a child and the system, right? A kid doesn't live by themselves. They live with people who take care of them. They live in an environment that was created for them. Um, so when a child can't speak for themselves, I think the only way you can really understand what's happening is by asking the parents. Um, I think when a child can participate and answer, then it is kind of an interesting piece to to compare those two sets of answers. What's important to the caregiver versus what's important to the patient? Because I do expect those things will be different too, right? The 10-year-old just wants to feel normal and not look different, but the parents don't want to get up at 3 a.m. Like there's certain things that are very different, but both are important, right? In a family, both are important. So I think it's taking into consideration all those pieces: support from social work, patient advocacy. Sure. Yeah. 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 Sure. There are very specific ones for children. So if you go on the Promise website, you'll see there's, if it's for a child, it will say school instead of work. The ones that I picked were more for adults. The Propel study was only for 17 and up. So you might see that depending on the age of the study too. But I think it's a really important point. There's different pieces that are important. Anything else? Great. Sure. Mm-hmm. Mm-hmm. Yeah. 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 Changes. Yeah. Yeah. Sure. Sure. Yeah. Well, I think Dr. Dirks has a good example of developing a disease specific measure. I think kind of what you're asking is the patient experience over time and what that is, what it means. Um, I think more emphasis is being put on that, especially by collecting these patient-reported outcomes. The FDA is requiring patients to sit on the the pharmaceutical boards that create these studies. So there's a lot of support to, I think, the patient voice, and I hope that that continues. Um, but again, your piece about what is it like for other kids and what is it like for other family members. I think it's places like this. I think it's making that known as important to the people that run the organizations, because there are ways to fund that kind of question. I think having social workers here that work with patients with GSDs, it's a really important way to get other people involved in research. Yes. Yeah. Yeah. Yeah, and depending on the center that you're seeing, yeah, you're absolutely right. Because what I've seen just in my work is that when there's more than one treatment available for a disease, right, you're trying to decide, the physician is trying to decide which treatment is best for the patient, right? And by having this data, honestly, a lot of decisions are made based on this patient reported outcome. The families come in and say, I'd like to look at that other treatment. Or you say to the physician, I feel like, my muscle weakness, you probably would say something more specific like, it's harder to get out of the car than it used to be. So looking at that kind of measure and collecting it more routinely, I think is important. So maybe even talking to your healthcare provider and saying, do you use these patient reported? Is it something that we could fill out every visit to see how things are changing for us? What do you think is the best report we could use? Or let me tell you what things are most important to me. Is there something that could track that?